What is CHIP? Who is eligible? How much does it cost? And is it any good? Especially for my fellow self-employed folks out there. I want to chip away at some of these questions and share a little bit about my own experience with the program. And I want to do this as quickly and simply as possible. So let's not waste any time and dip on in. CHIP, or the Children's Health Insurance Program, helps make high-quality, comprehensive health care affordable for families with children or soon to have children who make too much money to qualify for medical assistance, Medicaid, but don't make enough money to afford private health insurance. So in other words, like most of us. So right out the gate, let me dispel the myth or misconception that CHIP is only for people living at or below the federal poverty level. That's not true. In fact, it's for people living above the poverty level, between 170 and 400% of the FPL. People living at or below that level qualify for other programs that make healthcare completely free. CHIP can be completely free depending on your family size and income level, but I'm getting ahead of myself. We'll take a look at a pricing chart and see how you can figure out your family's costs. But first, let's just go down the list of eligibility requirements. And there aren't many. A child qualifies for CHIP if they are under 19 years of age, they are a U.S. citizen or U.S. national or qualified alien, a resident of the state where they live in, and they are uninsured or not eligible for medical assistance. And I believe they can be uninsured for any reason. Even if you have access to health insurance through your workplace and there's a family plan available, you can opt to go with CHIP if you crunch the numbers and find that it's more affordable or better coverage. CHIP covers routine checkups, well visits, immunizations, dental and vision benefits, which aren't included with some health insurance plans you get through your employer. So right there, it might be a better option depending on your circumstances. Emergency care, mental health benefits, hospitalization, durable medical equipment, substance abuse treatment, rehab therapies, home health care, maternity care, hospice and palliative services, medically necessary orthodontia, autism spectrum disorder, and related services. There's not a lot that CHIP doesn't cover. Now, CHIP is administered at the state level, so depending where you live, you might find there are slightly different prices and different health insurance providers available to you. I live in Pennsylvania, which, quick fun fact, was the first state to actually launch a CHIP program, and in '96, Bill Clinton signed a federal CHIP program into law modeled after Pennsylvania's. Way to go, Keystone State. A quick Google search for CHIP and your state's name are going to get you in the right direction, help you find where to apply and learn more about the pricing for CHIP. I'm on Pennsylvania's CHIP page, and I'll click Apply for CHIP. Then I'm going to scroll down and look for information about eligibility. View income and eligibility information. View the 2024 CHIP income guidelines chart. All right, this is what I was looking for. You can use this chart to see what we can expect to pay for CHIP. Based on household size, we'll go down here. My wife, myself, and 3 kids makes 5, so we'll go across this row here. Our youngest just turned 6, so ages 6 to 18. If we make between 43,186 and 67,538 this year, we would be eligible for free CHIP, and that is $0 premium, $0 copay, prescription drugs, generic, specialist visits, everything is covered. But what if you make a little bit more income? Well, just keep going across this table and find the income bracket that applies to you. Let's just take a look at 85 to 93K here, and we can see that we are still eligible for low-cost CHIP. That's going to be, on average, $74 per month per child. Now, this is just an average. The actual cost will vary depending on which health insurance provider we choose. And it's also going to incur a small copay for these different services here. Now, as a family of 5, if we made over almost $102,000 to no limit. Now we are in full cost health insurance territory. That's $235 per month per kid. That's triple what low cost is. Now, it's at this point that you need to crunch some numbers and decide whether or not it still makes financial sense for you to enroll your kids in CHIP. It might be more cost effective to go for that family plan, but it is still an option that's available to you. Now, if we go back to that eligibility page, we can find CHIP rates by participating insurance company. This shows us all of the available health insurance providers in our state, and it's broken up by county. So I'm going to be looking for Bucks, but I also want to take note of these columns up here, low cost 1, 2, and 3. I believe our family was low cost 3. So Aetna would be one option, serving Bucks for $71 a month. Can keep scrolling down here. We can find prices as low as $62 in this tier and as high as $114. That's why that first chart was just showing us an average. If we look at the full cost plan, it's quite expensive, up to $323. Does this make sense? There's a lot of different moving parts, different variables. I am just kind of simulating this using my own situation in my own state with my own family size and different income levels. You can play around with it. There's tools, there's charts, there's calculators that you can use to get a better feel for how much CHIP and other insurance options might cost you. Now, one thing to note, as you calculate your cost, they are taking a look at your adjusted gross income as reported on your tax return. Now, there's ways that you can control that, reduce that, by using different deductions and pre-tax retirement contributions. I talk a little bit about that in this video right here. Now, the application process was super simple for me. I just had my wife do it. But it is pretty straightforward, but it's time consuming. They want to verify your information and your income. So you might need to provide some documentation like pay stubs or tax returns from previous years. Do your best, fill in the numbers. They will reach out and let you know if you're missing any information. This past round of renewing our coverage, we actually had to go back and forth a couple times because they were missing some things, but we got it all cleared up. Anytime you're dealing with a government program, it's not going to be like the smoothest customer service experience, but just remember you're spending an hour of your time to save thousands of dollars over the course of the year. I think it's worth it. Which brings us to my closing remarks. Is CHIP worth it? Is it a good option? Now, I can only speak for myself, but for me, I say yes. CHIP has been very beneficial to me and my family, transitioning into full-time self-employment, starting my own business, walking away from a job that provided a nice benefits package where they covered the bulk of health insurance costs, now to it being all on my shoulders. And I don't know for sure how much money I'm going to be bringing in this year. That's going to vary based on what sort of clients I can secure, what sort of projects I get. This was a very stressful, scary situation to be walking into, but CHIP made it a lot less scary. I want to speak again to the stigma around this being a government program. Is it right for me to be taking advantage of this? Shouldn't I leave it to the people who really need it? I'm not too proud to say I am somebody who really needs it. I really need to insure my kids. This is what it's there for. If my business goes bonkers and I become filthy stinking rich, swimming around in my money bin like Scrooge McDuck, I will happily pay full price for a private health insurance company and pay back all of the subsidies that I have taken advantage of in higher taxes on my business. In the immortal words of Mordo, the bill comes due, and I will pay mine if and when the time comes. But until then, I have no problem and no shame taking advantage of a resource that has been made available to people in my situation so that I can ensure that my children are insured and have the health coverage they need. But what about me? What about you? CHIP covers kids. What about adults? Stick around and watch this video right here to learn about other health insurance options.